Hi, guys. This is the funny eye guy, Dr. Eric. I'm here to talk about why cops look at your eyes during a traffic stop. Now, I'm an optometrist, but I have an alter ego. That is, I'm an amateur stand up comedian called Divorced Asian Dad. Now, I call myself an amateur because I once choked during my first and probably my last time at the major comedy show called The Improv. Now, speaking of unbearable pain, I'm going to share how your eyes can land you in jail and how to stay safe and legal on the road. Let's dive in. So, I used to work at the county jail and state prisons for years, and I've heard quite a few stories from law enforcement about their interactions with drivers during a traffic stop. Now, I'll never forget my first day at the prison. I was in medical during my orientation, and the warden came up to me looking kind of concerned. He said, "Eric, you seem like a nice guy, but this prison is tough. The inmates will yell at you, they'll call you names, they'll even threaten your life. Can you handle that?" And I said, "Yeah, I've been married before." Sorry, that was my divorced Asian dad side. He's going to come out every once in a while. So, picture this. You're driving, just minding your own business, and all of a sudden you see those flashing blue and red lights accompanied by a loud siren. Now, the first thing you do, other than say an expletive, is to check if you've got your seatbelt on and go over why you're being stopped by the police. The last thing you're thinking of are your eyes. Now, they say that the eyes are the windows to your soul, but they can also tell the cops what your physical and mental state is, including impairment due to alcohol, drugs, and other factors. So let's begin. Number one, pupil response and size. Now, your pupils are the dark part in the center of your eyes that usually dilates and constricts in response to light. It's a reflex controlled by your autonomic nervous system, which makes it a good indicator of any physiological changes. So, what are the cops looking for? Well, officers shine their flashlight into your eyes and watch how your pupils react. Now, usually, your pupils should constrict quickly and dilate when the officer's flashlight is removed. Here's where it gets a little tricky. Now, pinpoint pupils, which means that the pupils are very small, like a politician's conscience, may indicate the use of drugs like heroin or prescription painkillers. On the opposite side of the spectrum, dilated pupils as wide as headlights on a monster truck. Now, the pupils don't react when the officer shines a light into your eyes, which may mean the use of stimulants like cocaine, amphetamines, or even methamphetamines. Now, if one eye is dilated and the other one is constricted, it could mean head trauma, neurological issues, or some sort of drug influence. Either way, you're headed to the hospital for a neurological review, or you're reserving a bunk in jail for a bad decisions retreat. Now, these are just indicators and not definitive proof, but officers are trained to look for these red flags like they're looking at a communist parade. Number two, eye appearance and redness. Now, not only are officers trained to look at your pupils, but also the whites of your eyes, called the sclera. It's like a PowerPoint of your poor choices, as well as the overall appearance of your eyes. Now, what exactly are they looking for? Well, bloodshot or red eyes. Now, to your typical patrol officer, he's not thinking Netflix marathon. He's thinking marijuana, since THC causes your eyes' blood vessels to dilate. Now, redness of the eyes can also be due to alcohol, fatigue, allergies, or area irritants like smoke. Now, it's fair to say that bloodshot eyes are only one factor considering the current context, such as if the officer smells alcohol or marijuana in your vehicle. Now, watery or teary eyes. Now, people cry for different reasons. It might be might be because of your team losing, but under the right context, it could also mean that there's booze or weed involved. For example, alcohol can irritate the eyes and cause them to appear watery. Now, droopy eyelids. Well, we're not talking the come hither look here. When an officer notices that your eyelids are all the way down, he's thinking intoxication from depressants like sedatives, alcohol, or extreme fatigue. Not something you want to show him during a traffic stop. Now, just to be fair, officers are trained to take everything into context. All the indicators are just that, indicators. but not definitive evidence to the point that the officer won't just look at your eyes and arrest you. But their observations as a whole will be the deciding factor, along with other factors like slurred speech, erratic behavior, combined with what your eyes look like, could land you a one-night stay at the county lockup. So, number 3, eye movement, also known as the Horizontal Gaze Nystagmus Test. Well, what's that? Well, that's when an officer tells you to follow his or her finger without moving your head during a field sobriety test. So, what's the officer looking for? Well, if you're sober, you can follow his finger smoothly. If you're not sober, your eyes jerk around or lag like it's being hit with a cattle prod. Officers are specifically looking for sustained, pronounced jerking of the eyes, like Elaine on Seinfeld trying to dance. Now, the dead giveaway is when your eyes jerk at extreme ends of your right and left gaze, or if they start to jerk at a 45-degree angle from the center. That's another possible sign of intoxication. Now, here are some other eye movements that officers are looking for. Number 1, rapid eye movement. That indicates nervousness, evasiveness, or stimulant use. Number 2, difficulty focusing. Now, when you're tired, everybody's a little, blurry, but it also indicates cognitive impairment from drugs and alcohol or just fatigue. Either way, it's not good. Vertical gaze nystagmus, number 3. If your eyes are darting up and down like a yo-yo, the officer is thinking possible high doses of alcohol, PCP, or depressants. Now, here's the silver lining. These eye tests are not set in stone. So if you have eye health conditions like multiple sclerosis, a brain injury, or genetic eye conditions, a traffic stop eye test can be disputed in court, especially if you have valid medical documentation. Either way, a well-trained officer will take everything into account, including the context of your traffic stop and any mitigating factors such as how you did with the other field sobriety tests, like walk and turn, one-leg stand, as well as the breathalyzer results. Now, looking at your eyes is one factor, even though a very important one, that could be admissible in court. So, have I got you freaked out yet? Now, every state has its own specific laws when it comes to this topic. So, if you're really concerned, check with law enforcement in your state for the details. So, guys, take my advice. Keep your eyes clear, your wits sharp, and sober. And avoid being someone's girlfriend in prison. I've seen it happen. It's no surprise that inmates make bad boyfriends. Just don't do it. So if you like this video, give it a like and share your funniest eye-related traffic stops in the comments below. Watch out for my next video. Can my eye doctor tell if I'm pregnant just by looking at my eyes? Yeah, guys, it's real. So I'll see you later. Stay sharp.